As a result of vaccine mandates continuing to take effect across work industries, one group has been impacted significantly, that of course being medical workers, including those who are in southern Oregon. Newswatch 12's Daniel Ramirez has spent the day looking at the magnitude of the vaccine mandate in our area and what can be done in the next few days to make sure the mandate is being withheld.
Brian, when Newswatch 12 reached out to the Asante Medical Center about the vaccine mandate that would be taking place across their facilities, they seemed pretty hopeful that all their employees would abide by those guidelines, although looking on it now, that has clearly not been able to be the case. Now, this only adds to the staffing troubles that the Asante Medical Center has been facing since the start of the pandemic last year, especially at a time considering the sudden surge of hospital patients at the hands of COVID-19. Staffing has been a critical focal point in making sure patients receive the treatment they need as soon as possible. And now with these recent resignations and the constant concern for peak capacity, officials are assuring it won't get in any way of critical service.
We're finding that there might be some delays as far as a few services. Maybe a lab result, instead of getting processed in 1 to 2 hours, maybe takes 3 or 4 hours, depending on really what the capacity is at that time. But for the most part, all the critical services that we provide for the community will remain intact and will move forward.
And Van Sickle added that these shortages they're facing isn't just an issue in our neck of the woods, but nationwide, as it seems that there are already enough people to fill in a variety of frontline health positions across the U.S. Coming up on Newswatch 12 at 5, we'll hear from another local medical center on how they're handling their employee resignations at the hands of the vaccine mandate and the state-funded resources they've been able to receive along the way. Reporting live in studio, I'm Daniel Ramirez. Back to you, Brian.